So it's really my pleasure to welcome Karen Akins. She's the documentary filmmaker of El Susto. And as you might have seen, El Susto is an award-winning documentary focused on type 2 diabetes and really the causes behind the high prevalence and incidence of that in Mexico. And she's going to talk a little bit to us about what inspired her to do this, to make this documentary, and equally what maybe has or her next actions. Rebecca is Institutional Development Director at El Poder del Consumidor. It's a Mexican nonprofit organization. If you've watched the movie, then you will know that they work with the Nutritional Health Alliance in Mexico, and they work a lot on trying to raise awareness, equally to bring about policy change in the country. So we're going to hear more from Rebecca about how that happens. And finally, it's my pleasure to also welcome Peter Conteh, one of our colleagues from Sierra Leone. And again, he's coming from a family of 11, he tells me, which is by itself really a big thing. And Peter has worked with us for the last couple of years on a project that's dear to us on social mobilization in Sierra Leone around salt consumption, particularly in rural communities, which you will have seen again from El Susto, are a particularly vulnerable population sometimes, and also maybe a captive population to risks that industry might bring into communities. So welcome again to you all. I'm maybe going to start with you, Karen, if that's all right, and just ask you, what inspired you to make El Susto?
First of all, thank you so much for having me. And my son went to school in the university in Edinburgh, so I love seeing you guys, knowing that you're sitting there in the beautiful city. So anyway, thanks so much for having me. So the story of what inspired me is sort of just the story sort of dropped into my lap. I volunteered to go on a medical mission with a bunch of nurses from Vermont, where I live. They were going down to the Quintana Roo area of Mexico, and I sort of tagged along, and I had no idea what I was getting into. But when I was there, I went for a month, and we were on a diabetes blood sugar testing mission, and we were going around and testing various populations for their blood sugar. And I just really couldn't believe what I was seeing, very high levels of blood sugar, people that had no idea that they had diabetes, little children with their teeth all rotted out. It was really a shocking thing for me to see and to learn about. And I felt like I needed to tell other people what was going on. And sort of the more I learned, the more I felt like I wanted to do something, and I chose film as a medium because Mexico is a very beautiful place with wonderful people, and I just felt like if people could see what was going on and hear the story, people would be moved by it. And much later in the process, I did meet people like the El Poder del Consumidor staff, like Rebecca and Alejandro. So it was a wonderful journey to take, but it very much started with sort of on the ground, medical mission that I was volunteering for.
Thank you so much, Karen. And just to also ask a little bit, I mean, like you say, it's your first kind of work in that sense, but obviously very inspired and grounded in that local reality. And I'm guessing in that sense, it has been a challenging maybe undertaking for you to do that, to make that. And I'm just wondering, have you faced any pushback during this process or even after it?
I think it was a very difficult project, not just because it was my first documentary. I was working in, in a foreign country in a different language. And then in the middle of it, I learned that some of the participants were had gotten death threats and were being spied on by the government. So it's like everything that you can imagine was like challenging, came to bear. But, it just, to me, made it more important to do this story, because the more pushback there was, the more need for counter pushback. So, I felt like the more people could know the story, the more people would have a voice and to tell what was happening to them. So I felt, I did get pushback from the industry, very light. I actually expected more. Maybe more's coming, I don't know. You know, like I said, but you know, if you're working on something important and you're trying to tell the truth, then it's gonna hurt somebody's profit. They are gonna push back. So that's really not that expected. So, but I think the importance of the whole story made me push back through any of that stuff. It really needed to be told, and people all over the world are, you know, it's resonating with them because it's happening in their own countries, and they can see a way through by looking at the Mexican example. They don't just say, well, it's not, we can't do anything about it. I mean, they do have a model now for where they could go with their own country.
Thank you. No, that sounds absolutely great. And like you said, it was quite evocative, I have to say, to see so much pushback being directed even in the movie. And you've made that very clear and transparent for people. And it's really kind of inspiring to see you all standing up against it. So thank you so much. And I think I would like to come to Rebecca, because obviously being involved already for years, I'm guessing, in this kind of fight, I'm just wondering if you have some comments about, well, what is this model that we should be following to really try and engage with these industrial interference and with these processes?
Thank you so much. Thanks to everyone for your interest in the Mexican story. I think a lot of what we have been able to achieve has resulted from being inspired by other public health successes in issues of tobacco control, the seat belts, you know, across the board. And this is one of these issues where, in the end, one of the lessons learned that's been the most important is to prepare for the opposition. That's definitely the case. You have to know that you're up against very strong industry opposition and interference in these processes. And I think one of the things that we most, I think, have learned from this process is that there's no single model. I don't think there's a model, but I do think there's a lot of lessons learned from the process over the years, you know, starting with the push for the sweetened beverage taxation in Mexico that some advocates, some champion legislators, an academician, kind of over the 2008 to 2010 up to 2012, had kind of had individual efforts to try to, you know, say that this would be a very important policy measure. And it really started coming to coalesce around 2012, 2013. And as Karen tells the story, you know, of the advocacy process in Mexico, where a lot of different kind of tactics or strategies started coming more to light of the combination of those, how you could be more powerful as public health advocates. And some of those, of course, have to do with, you know, starting with the science. You know, it starts with the science. You need strong scientific evidence. You need to put that out there, but you need to disseminate it in a way that is communicating with where the society is at in terms of understanding the risks to health of these products and to be able to begin to identify them. And in that sense, what we tried to do with our mass media campaigns with the Nutritional Health Alliance was really to start at the moment of conversation and the level of understanding where society was at. There still wasn't an understanding in Mexico at that time of the harms from consuming soda. You know, even to this day, over 50% of the added sugar in the Mexican diet is coming from sugar-sweetened beverages. Imagine what that figure would look like if we were talking about, you know, 8 to 10 years ago, and then go back to 20, 30, 40 years ago, where that wasn't the case. And so something that the population wasn't aware of needed to be put in front of them, and to kind of reach out from their level of understanding, because sometimes we can be just in our bubble as public health advocates of, we know the science, we know the answer, we know the policy that we need, but we really need to create a conversation with society about this at the same time that we're building a stronger alliance, or many different alliances, and creating a stronger coalition where people from different sectors of society, both in terms of the academic community and civil society and normal public health advocates, are reaching out and conversing with children's rights advocates, people who are concerned about the environment, people who are looking at this from the affectations that it has on food production and the farming communities. And then, of course, we really would have been remiss if we wouldn't have been reaching out and dialoguing with and learning from the global public health community. And there were a lot of experts over those years who gave their time and their energy to be on peer review boards of the evaluation of the soda tax, international organizations who spoke out in favor of this and or came to Mexico and spoke in public events. And so that level of networking and dialogue really helped create a new conversation and a new public debate about the harms of sugar-sweetened beverages to health. And those experts on the field talking about the harms and coming from the international global health community really helped do something that sometimes I think happens in a lot of countries, which is that no one's a prophet in their own land. I don't know if that's a common phrase in other places, but we had a lot of people working on the issue here on the ground in Mexico. But it was very important as well for the Mexican media and Mexican advocates to have the support of, and Mexican legislatures and Mexican authorities to be also saying that it wasn't just a bunch of crazy people saying we need a soda tax, that this was going to be the best practice, that this is what scientific evidence was telling us, and that Mexico needed to be one of the first countries to implement this at a national level.
Mm-hmm. No, thank you. And that's a very good response. And I might come back a little bit to ask more about that coalition between all of you and how that formed. But actually, I'll want to bring back, and I know Karen's probably turned her camera off just because of the storm outside. We should preface for everybody listening. But actually what's striking about, oh, you're back. Both when you watch the movie, and again, for some of my colleagues who might not have heard, for the audience joining, obviously you said a very important thing, Rebecca, that you try to communicate with society where society is at. And so that was part of why I'm guessing you called it El Susto. And I wonder, Karen, if you could speak a little bit about why that name, why focus on that particularly and bring that to the fore?
Well, so many times when we were in not just remote Mayan villages, but even sort of urbanized areas in Mexico, when we were testing someone's blood sugar, if it came back high, and you would say to them, I'm very sorry to tell you, but you've got diabetes or pre-diabetes, whatever. And, very often their response was, oh, I got the Susto, and we're like, what? We're just like, I didn't understand that concept at all. And we kept hearing it. And it wasn't really until I was interviewing Dr. Zazueta in Austin in making the movie, and I kind of had this throwaway question where I was, at the end of an hour and a half, I just kind of asked, what's the deal with Susto? And she gave us this very eloquent explanation. And I'm like, wow, that's really important. And, it sort of works both ways. It's sort of what they culturally believe gives them diabetes, but it's also, if you think about it, diabetes is like a processed food shock. It's the whole culture is suffering from the shock of their food systems being destroyed and this influx of processed food. So it sort of works both ways. And I think if you don't understand the disconnect between what people, in their daily lives think that's giving them diabetes and what's, really happening medically, I think you missed the story. So it kind of worked both ways. We had alternate titles, but that one,
that one stuck. No, that's great. And actually it brings us neatly, I think, also to some of Peter's work in Sierra Leone. And Peter, I wonder if you want to reflect on some of the social mobilization work that you've been doing, because a lot of times I know you've used very much local language or tried to understand how, again, local communities obviously perceive risk. I know your work is in relation to salt, but maybe you could speak about that.
Yes, thanks very much. And to the entire team, I'm sure the Mexico team is doing a very good job, because looking at the examples they've started and doing something for the interest of the people is not like when you want to take a credit for it, but like you want to save and touch a lot of lives around the world, and you want to share a story and a model that this is what I believe and this is how I want to impact others. So I'm sure it's a very good one that they've started. For us in Sierra Leone, I think it started some years ago, but like the government was not like wants to commit themselves into the process, because they think there is not much audience on it. There is not much people to talk about it. And I'm sure it's reached to a point where people said this is quite dangerous and we need to begin to talk about it. And it's no longer like just a silent killer disease, but now it's like it's coming out in the public, and we must show that kind of attention to it. So I'm sure that was how it started, and we started talking about it, and there was a video documentary Karen and the others did when he was working with VSO, and that one touched government. I know the issue of fight back from the government side is always there. They did that documentary, and for me, that's what inspired me so much, because in that documentary, they were talking about diabetes and high blood pressure. But the main context of that documentary was on diabetes. And there are a lot of causes, and government is like pushing back that no, we are not like the cause, and because we've established this, we've established that, and there is not much to talk about, because if this is happening, then where is the evidence? So I think when people started talking about it, it becomes a public concern and the government shows attention. So likewise, the social mobilization we are doing in Bombali, in McKinney, that's how it started gradually, because the perception, the thing we want to show out, that we want to encourage people, especially when it comes to their diet, to reduce the content of salt they are taking. And for us in Sierra Leone, there are a lot of forms that people do take salt, people do eat salt. So we've discovered that a lot of it is now the fastest cause for stroke and hypertension. And we begin to talk about that. And COMAHS was very emphatic on that one, to see how we can push the issue forward to government, that government will make commitment to that they themselves, they are aware and they want to commit themselves that in the fight. So I'm sure it's not too much different from what the Mexico team is doing, even though they are doing more of diabetes. But for us here, the high blood pressure is a serious case. Though now, because people are talking about it, is now what we are saying, we try to break the silence, because a lot of people have been dying and without diagnosis and to know. And it is not like Europe, when someone died, they will diagnose and know the cause of death. For us here, it is not a usual thing. Someone died, they bury the person, that's the end of it. They will not want to know the trace, the cause, and so forth, so that they will find a cure. So for us, that is what we want to stop. We want to bring it to the light. We want to encourage people to change their diets, and also to come for like a normal routine test, to do their screening, to know if they are a high blood pressure patient. They advise them, and at the end of the day, they like do the exercises they ask them to do, and also to eat the right food and reduce the content of salt they are eating. So I'm sure now government has committed themselves to it, because that's what we are pushing for, that government must hear our voice and should make commitments.
And should reply. Yeah.
That they are ready to join the fight. And because for all that we are doing is government fight. Is not, we don't want to own the fight. We want to bring the issues to them and say, these are the issues. We profile recommendations, and we want the government to take the fight, because when government take the fight, even those who are working at the peripheral health unit, they will also take it so serious, because it's coming.
It will be from the government.
Yeah. So
thank you so much.
They've established a secretariat for that, the non-communicable disease secretariat. They have a directorate now. I'm sure they are making progress on that.
Brilliant. Thank you so much, Peter. And that's really interesting, because you're very much at that start, right, of that journey that potentially in Mexico is now at a different stage. But that's really, really interesting. I can see a couple of questions coming in via the Q&A. So I'm maybe going to start directing some of these to you all, and then maybe I'll jump back to some of the other questions that I had as well. So I think, let me start with one question, basically. How do you feel that the agenda for change, I'm speaking about Mexico in particular here, how has it been genuinely owned or led by those most affected? So, patients themselves or people affected by diabetes themselves. Maybe to Rebecca, yeah?
Sure. I'm not sure that it has so much. I would be remiss to try to speak for someone else, but I think that it's important to note that I don't think that the public health system or the private health system in Mexico has encouraged peer communication, peer understanding, peer orientation, and participatory community models for people to be able to meet and connect. There are efforts like the efforts that Karen was familiar with. There are a lot of community clinics. There are an increasing number of organizations that are like, grassroots, community-based organizations who are not dealing with public health issues, and then discover all of a sudden that they have large groups of their members who are living with diabetes. And I think that there are some groups who participated in the coalition here in Mexico that's called Contrapeso. Counterweight literally is the translation. A counterweight politically and a counterweight in terms of the economic interest of the industry versus the public interest. It's a network that has many different organizations that are that consist of people living with NCDs. And I think that that's an important effort and a very important voice. But to be honest with you, I don't think that has been given yet even enough space, or that there are enough models. There are a few universities in Mexico who are working from a public health perspective, trying to strengthen this kind of community-based participation, trying to strengthen this patient-to-patient conversation, to be able to not only have people have greater information about how to attend to their own condition, whether they're pre-diabetic or living with diabetes or a heart disease, but also whether or not they're being able to take a next step to mobilize and better inform their community, be part of the prevention effort, and to be part of an advocacy effort. I think that that's something that is still fostering and still and still needs to be strengthened more through universities, through advocacy groups, through grassroots organizations. I don't know if Karen, you can speak directly from on the ground from what you saw when you were in the Yucatan Peninsula, and how that works a lot of the times with smaller groups or groups that are sometimes organized around clinics. But I don't think that these groups had much of a voice. I think that they were well represented in the effort for the national policy efforts, but they had a voice from time to time, but I don't think that they were one of the strongest proponents because they're not one of the most strongest organized yet.
Yeah, no, that makes a lot of sense. Karen, would you like to come in on that? Because I think that's quite an interesting topic and question.
The medical infrastructure is so undeveloped. It's hard to even explain that people don't even have a local clinic, or their region of the country may not have an ambulance service. And the volunteer work that I ended up getting involved in was actually started by like an American woman who was on vacation down there and heard about somebody dying the night before he died of diabetic shock, and nobody even knew he had diabetes. So, this is 20 years later, that area now has an ambulance service and they have some, clinics, but I mean, there are huge parts of the country just because and things like COVID, it doesn't help that those resources are so limited that, and that's a problem, that diabetes is a silent killer. Very often you don't know for many years if you're suffering from it. So it's sort of everybody's daily struggles with diabetes sort of doesn't rise to the level of anybody's medical emergency unless they're, having to have a limb amputated or something like that. So there are efforts, but I think there are, pockets, but, even, as I tried to point out in my film, even, people couldn't even afford to be testing themselves on a regular basis because the test strips are too expensive. So, it's just such a huge problem, and, it would be easier to just probably deal with it at the consumption of the nutritious foods and everything than treating it medically on the other end, because, you know, prevention will pay in this case. And they've got a great leader at the national government, the nutrition, institute. But, you know, there's just so much that they can do to get their own public health messages out. I feel like there needs to be, you know, a change in the culture, but, you know, I'm sure that every year that goes by, there's an improved awareness of people of the harms of sugary drinks and processed foods. But, you know, anything like that takes a while.
No, and it takes also, like Rebecca was just saying, the culture, right, of connecting with each other, realizing it is a joint problem potentially that you've not spoken about, like you said, a silent killer. Peter, I wonder if you have any reflections on that from Sierra Leone, like our communities. So you've done obviously a lot of this social mobilization work, and, you know, how do communities themselves, or people with hypertension in your case, how do they engage with this process? How do they own the process, if they do?
Yes, for us, the most important thing, we engage the people and we allow them to participate from the start of the process to the end. And like most of the ideas, we allow them to think and create something out of their own that we use to reach others. So that is why looking at the way we design our strategy is community-led, community-owned, because these are problems that we train them and we show them the problems, they themselves. What we did for the screening, the 20 people we trained, they were the first people we screened. And out of the first people we screen, from those who have high blood pressure, automatically they know that, oh, people can live with it around us, and this is no longer a secret, that within us people have it, and it's just like controlling your diet, and you make sure you tell others to come for screening, because if they don't have the opportunity to come forward to do screening, they will not know that they have it. But when they come for screening and they are being tested and so forth, so they will now know their diet, they will now know how to control it. So what we did is a two-way approach. We engage the government, we raise the awareness at the local level. So it's both raising the awareness at the local level and also engaging the government at the national level. So we raise the awareness so that we are not saying we redundant those who are selling salt, but we allow the people to make a choice, to make a decision on whether to buy it as they used to or to reduce the quantity. So what we do is to give them the opportunity to make a decision on their own. And like, you used to have this quantity in your sauce, but now reduce to this quantity and see how it will help you. And gradually, by reducing that one, they now, the people who are selling salt are now complaining that people are not going much for their product. So because for us, we've not seen the willingness in the government to increase tax or make a policy on that. All the government is doing, will back you up. We are willing and committed into the process, and we are going to establish a particular unit within the peripheral unit for screening of people who are high blood pressure and diabetes. And for those with diabetes, there are treatment cards. They do take their records and so forth. But there is no commitment that we are going to put a tax increase on salt or sugar. That one has not happened. So that is why we are raising the awareness at the local level, so that people can make a decision on whether to eat too much salt or to eat less. And with the examples they've now seen, that people who have been eating too much salt, most of them have been proved positive of high blood pressure. And now because they've reduced, they've seen the changes, their swollen limbs, their faces, it has reduced.
Different.
So now they've known that, yes, this is true. And because it reaches in our local language, we really need to take advantage of it.
Thank you so much, Peter. And maybe I'll come back to that a bit later on, because what you've said is something quite interesting about essentially small sellers or vendors, which equally Karen touches on in the film as well, and how they might perceive changes like this. I'm going to ask, so we have a question coming in from Kanike, who's saying, thank you very much for the film, extremely well done. Her question is really about water and the availability of water in Mexico. So in the film, an interesting point is made that communities encourage children to have the sugary drinks because they lack a proper water system. And has there been any progress in that regard? Do you know, or even how is that problem really playing out?
I wish that I had, oh, go ahead, Karen.
Both of you.
No, I was going to defer to you, so please.
I wish we had better news. There's some good things. There's some progress, and yet there's not. One of the most important things I think about the push for the national soda tax in Mexico and its achievement in 2014 was also the conversation that started or that was fostered in addition to water rights advocates who have been talking about what's happening with the privatization of water. Was talking about water access and saying, do children have access starting in schools, right? So if our schools are the place where we educate children about life, about what they need to know, right? And what they should be eating and what they should be drinking. So do we start out also having access to potable water in the school system? And so for those of you who are familiar with the Mexico campaigns to push for this soda tax, there was a conversation around the importance of kids just having access to water and having water fountains or dispensers in schools, and for the money to be earmarked for that to take place. So the bad news is that the Mexican government, legislature, never wants to earmark anything. It's not something that the Mexican kind of system and government is accustomed to. They'd like to bring in all the money into a single bag and then be able to year from year decide where it should be distributed out. So even there was a push from champion legislators as well as advocates to have that money earmarked, there was a very important societal conversation that was started around that and public debate that was started around that based upon advocates and academicians asking for the tax to be earmarked. And that meant that there was a national water program for drinking water fountains in schools that was started. There was an actual earmark that was put in the federal budget for 2 years running to be able to assign money. And then advocates had to come out again and say, where are the drinking fountains? Like, you assigned the money, now where are the drinking fountains? Because it's not something that, even with all of the realities of limited infrastructure, insufficient infrastructure in schools, there wasn't the capacity to necessarily give this the prioritization that it was supposed to be given. So a huge number of water fountains and dispensers were established in new primary schools and in a whole series of primary schools across the 3 regions of Mexico with that national program. And we know that more children had access, but that doesn't mean that they were necessarily receiving it with good hygiene. It doesn't mean that they were necessarily, that now they're in maintenance again. Well, now with the pandemic, that's not the case because people aren't going to school physically. But it's not an issue that's been resolved. And it's part of the continual push that needs to be made by advocates and by academicians and by children's rights defenders to continue to have this conversation on the table. There's also a push in Mexico for anyone who's ever interested in more information to have the passage of a national water law, which also would end up establishing the right to water, the right to free, quality, potable water universally for Mexicans as one of the issues for water rights protections. And there's been huge pushback from many different industries, not only the food and beverage industry, but also other industries that are involved in, directly involved in agricultural production and energy, as they're wanting to continue to have their private concessions and to be able to continue to, this word in Spanish is acaparar, to like keep their hands on, and to make sure they have control of the water supply. And so it's a major issue and not an easy one in terms of all of the different economic interests that are involved, that are creating and have for decades now had a head start on talking about the right to water and the importance of the right to water and potable water for all people across all society. And it's a very important issue also in terms of just contamination and pollution. One of the things that we're seeing increasingly, and I'm sure that many of you are aware of, is to what extent, three of the largest companies, transnational companies in the food and beverage industry, are three of the biggest polluters with PET worldwide. And that's because of the amount of bottled sodas in Mexico, bottled sodas, bottled drinks in general, and also bottled water that people are having to buy because they don't trust the water, either because they shouldn't or because they don't know if they can. And so it's a major issue that we continue to address.
No, that's brilliant. Thank you so much. And that explains a lot. And again, I mean, it's very understandable why mothers in those situations would obviously go towards that. So we have a question from Alistair Ager, who's actually our RUHF director. So Alistair, we will unmute you to ask the question, and I'm hoping one of my colleagues is doing it now. Let's see, I think his question's for Karen, actually, very specifically.
Yeah, thanks ever so much. It is for Karen, but I wanted to reflect and thank Rebecca and Peter for sharing around the public health messaging. But the question, Karen, for you is really about the film and the cinematography of the film, essentially. I've been really struck this week as I've looked at various animations and other videos that we've used, how important the feel of a film is. And in my written question, I don't know if you've seen it, I just felt this was much more filmic, much more visually compelling than I was expecting from a documentary. And I wondered how conscious that was with the team that you were working. I mean, it's a beautiful opening sequence in terms of the Day of the Dead. It's very compelling. And I'm wondering if this is sort of public health messaging growing up a little bit in terms of its recognition of the importance of communication beyond a key message and sort of slogans to something that is genuinely evocative in terms of the full senses. So I'm partly just thanking you, Karen, for the vision of yourself and the team in producing something so visually compelling. But I assume you think that visual compellingness is not unrelated to the issues we've been talking about, that Rebecca was talking about there, about ways of communicating, the ways of influencing. So I just wonder about your reflections on how the film feels and how you wanted it to feel.
Well, thank you for the question, Alistair. I think I was always so overly conscious of how in the world I could get normal people to sit there and watch a movie about diabetes. You know, it just sounds like a subject that may not be enticing. So I think I went maybe, overboard maybe, and just throwing out eye candy, beautiful Mexican culture, parades. I really wanted people to get immersed very quickly into the beauty of the country and the beautiful people that lived there, and then pull them into the story about diabetes. So that was done very consciously. If you're only going to make one movie in your life, you should try to make something that people actually want to watch. So I think it was my my film friends telling me, no, you can't just have people in clinics. You've got to pull them into the culture. So it was my first film, and I got lots of good advice from people about how to make it more cinematic. Even the name El Susto, they wanted it something sort of cinematic. So instead of, it's all important, because if you want people to be emotionally moved by your message, and that emotion is going to be what translates to action on the ground. It's maybe change policymakers' minds. You've got to do everything you can sort of emotionally to pull people into the story. And so if you thought it looked pretty, that makes me very happy. And I probably kept a lot of people watching when they might not have thought it was something that would be an interesting topic.
Thanks so much, Karen. I very much so feel so. Thank you.
Thank you so much. And I don't know if maybe Rebecca wants to come in and maybe comment on the public health messaging part of Alistair's question there, or other bits.
Oh, I just want to also send a shout out to Karen, because I think, Alistair, your commentary is very, very spot on. We had produced a previous documentary in Mexico called Dulce Agonía, Sweet Agony, the toll of junk food. And we suffered with that very same issue. How do you get people to watch an hour or an hour and a half about an issue that is so troubling and so concerning, particularly if in Mexico, and I don't know to what extent this happens in the countries where you all are originally from or reside in, if you get in a room these days and you ask people to say, how many people who are here today, have someone in their family or your immediate circle who's living with diabetes? I used to ask that question 20 years ago, when I was working, in communities here in Mexico, and the difference of asking that 20 years ago versus asking it today here in Mexico is terrifying. And people prefer not to talk about it and not to think about it many times. And I think until you start the conversation and you have people talking about it, right, that's when you can get more people mobilizing about it. And Karen did something that I just want to, for those of you who don't speak Spanish, or those of you who do, there's an expression that's called a taco de ojo. And you called it eye candy, Karen, but I think, it's like a taco for the eye. And I think Mexico has a real, kind of folklore around it, and a stereotype of what a wonderful country, and tourism, and the beaches, and the good food, and all of this. And underlining all of that is this wonderful traditional cuisine and food and culture and harmony and hospitable people that at the same time live with this tragic reality, and the tragic reality of corruption and industry interference in determining the policy agenda. And I think she really gave us, like you said, Alistair, like this really compelling trailer that we were just like, we were all, all of us at the Alliance were just thrilled by the trailer, of getting a new way of getting people sucked in, right? And engaged with looking at these beautiful scenes of Mexico and seeing them side by side. And understanding really, and talking about, the reality of Day of the Dead in Mexico and its importance to culture. But at the same time, using a really iconic and unfortunate reality as well to talk about diabetes being caused by, what the real causes of diabetes are. And so it's a great conversation starter in so many ways. The title of the film, the trailer itself, and I think that it gives us some great examples, not only for working on this issue in Mexico, but for working on other issues in Mexico and other places.
Mm-hmm. No, absolutely. And that kind of comes back even at the end of the movie, right? When you see all of that mobilization around Day of the Dead again, and around the promises and everything that are being made by policymakers now in light of that. So that's really interesting. There's also a question I'm going to link to somewhat. I mean, there's also Tizo, who's our filmmaker in Sierra Leone, actually. He's also saying and noting, obviously, you're using the Coke brand, as in you're showing it and you're not afraid to show it, and you're putting it out there in various ways. And equally, even in Mexico, you're using it, the same kind of font, the same kind of colors, everything. And he's wondering, is the company okay with that? As in what was their immediate, I'm guessing there was a response. So yeah.
Well, to protect myself, I hired the best clearance attorneys for documentaries that went through frame by frame on the film and told me what I could and couldn't do. So, and that was important. That was because, why put something out there that's just going to get shut down by the lawyers in a week. So, I didn't do anything that could be considered defamation. I maybe had to change a couple of things, but, for the most part, it went through a rigorous legal process. People can always sue you, even if they don't have a basis. But, I talked to a lot of people that have been going after Coke for a long time, and they have a culture of not suing. I hope they're not watching and don't change that. But I mean, I did discuss that. But even our logo for the movie incorporates, sort of a parody of the Coke logo, but parody in the United States is protected free speech. So, I'm luckily we have yay free speech. So.
Yeah, well, there we go. That's a good one. Right, I'm going to encourage people to post any more questions that they might have, but if none are coming in, I want to end on two. So one, I would maybe like to hear a bit more from Rebecca, just on the situation now in Mexico, what the successes have been, particularly following the tax, and then equally maybe it's inspired other action. And maybe I would like to end on a topic that you've all spoken about in one way or another, which is this coalition of diverse groups and people, whether it's communities, filmmakers, policymakers, others kind of coming together. What are the real opportunities and future around that? But Rebecca, first to you, and then I'll go to all of you for some closing remarks on that.
Thank you, Karen. There's exciting news from Mexico. It's quite fun to be here on the ground. In the first 2 years of soda tax implementation in Mexico, of SSB soda taxation, in the first year alone, SSB consumption decreased by 6%. But by December of the first year, that reduction was actually at 12%. The poorest households are the ones that saw the largest reduction, with an average decrease of 9% in the first year. But by the month of December of that first year alone, it was at a 17% reduction. So there's an immediate impact that was seen in 2014. And these are the results of peer-reviewed evaluations that took place that were led in large part by the National Institute of Public Health here in Mexico. At the same time, the purchase of untaxed beverages, such as water, increased by 4% in that first year alone. And by the second year of implementation, there was a 9.7% reduction of purchases of SSB nationwide and an increase of 11.8% in the purchase of untaxed beverages. So that substitution effect was immediately seen. And I think that, that's one of the most important things, I think, in terms of, not only talking about the reality of the stigmatization of this category of beverages that are clearly addictive, are clearly causing public health harms, both immediately and with long-term, risks and effects. But we're also seeing then a policy shift in the sense of, thanks in large part to a new administration here in Mexico as of 2 to 3 years ago, that has shown even greater interest in looking at the recommendations of scientific-based policies for obesity prevention to promote better health for the population. There's also now been passage that was first passed under the General Health Law by Mexican Congress, and then implemented by the executive branch almost in parallel, new front of package warning labeling. And this new front of package warning labeling that went into effect in October of last year, and now is starting its second phase of implementation as of April 1st. So just in a couple more days, is now nationwide. Now, wherever you go, where there's an excess of sugar, salt, fats, trans fats in a product, that you will now see on the shelves of Mexico, all of these products, like in Chile and like in Peru, who kind of set the groundwork for all of this, to have a warning label here in Mexico. And something that's very exciting about the Mexican label is that it has two special legends or two special banners that you don't see yet in other labeling efforts like this. They're innovative, is that there's a new label that is warning society about the potential harms and risks of artificial sweeteners for children, as well as the risks of consumption of caffeine for children. And so this is now implemented nationwide, and it's harmonized in the sense that this also means now that beverages, as of stage 2 implementation starting in April, that also foods and beverages that have that labeling now have restrictions on the types of advertising they can do and whether or not they can include characters on the packaging. And it also means that these types of products, when we do return to school physically, which we all hope in your countries and all of us will be soon enough with protections for children, that these types of products that have the label will not be able to be sold or offered or provided in school canteens or as part of the school breakfast programs or the school lunches or sold at the little cooperative stores like we have in Mexico. And so that's the big, most exciting kind of parallel process that is allowing Mexico to take another huge step forward in having an integrated, comprehensive policy package. And then most recently in Oaxaca, in the state of Oaxaca in southeastern Mexico of last year, local advocates, people, teachers movements, people concerned about public health, actually put forward an initiative with a legislator who became the champion of this effort to prohibit the sale of junk food to minors in stores and in schools. And this is receiving a huge amount of industry pushback, but it's something that is very, very innovative and very important in one of Mexico's poorest states, and that actually has one of the richest, traditional cuisines, access to fresh fruits and vegetables, production locally in many of those municipalities. And so it's exciting to see these huge pushes come forward. Mm-hmm. But they're all receiving industry pushback, and that's a whole other conversation.
Yeah, but it's exciting to hear that it's inspired all of this movement, and especially also it's strengthened, it sounds like, that evidence to policy kind of channel, if you like, that has existed, but maybe you've catalyzed a little bit. Surrounding that, there's actually a question I believe Jimena has, and potentially the role of documentaries, particularly. Jimena, I don't know if you want to go live.
Hi. Sorry, I have the privilege of turning on my camera. In connection also to Ibrahim's remark about how we should, that it's such a helpful tool, a documentary, to create the public awareness around the issues and stimulate public policy debates. So I really want to thank you, and also it's been amazing to watch, and it really shows the power of documentary as a way in spreading the message. And I can even recall with hindsight now that in 2016, South Africa actually introduced the sugar tax as well, which was absolutely great. And it's all following from this, these activities locally and the documentary, I'm sure. So I was wondering how integrate documentaries in stimulating our work and raising issues. What would be your advice on that, Karen?
Well, I think there are documentary filmmakers in a lot of different fields that are working with people in the scientific community to help amplify their research. And it's such a a scattered effort, it's people here and there, but there are so many that are being made that are scare tactics, very poor science behind them. There's no the problem is anybody can pick up a camera and make one now, and they're not maybe going to have the same levels of evidence that other ones do. So I think the community itself, these food films, there are a couple of them that are just really horrible out there. That I think that it's important for the scientists to be open to working with documentary filmmakers. In this case, people were very generous with their time and knowledge, and helped when I was struggling to tell a certain part of the story. They would correct me, or we went back and forth and made sure that we had everything accurate. So I think having researchers and the academic community more comfortable working with filmmakers and not seeing them as some enemy that's trying to do a gotcha movie, but are trying to help them. But also I think even as public health scientists, you should learn about storytelling. I mean, that's the way people learn things, and that's what changes minds. And I think that you can incorporate storytelling into your everyday work. It's very different from writing academic papers, but I think they should have a storytelling class in global health programs, so that you know how people, because that's the way human beings receive messages and remember them as stories. So I would hope that you would take it upon yourselves to learn learn that skill. I learned it very late in life, and everybody else can too. So
I really like that. Thank you.
Thank you so much, Karen. And I believe we're almost on time. So actually what I'd like to end on is just to ask all of our panelists for maybe one reflection or one key lesson that you want to impart with our audience or with anybody listening in about how the importance of working together between academia, between advocates, documentary filmmakers, any reflection that you might end. And I might start with Peter and then go to Rebecca and then give you the last word, Karen. Peter, do you want to go first?
Yes. Working with diverse professions, I'm sure it's really helped because like working with filmmakers, it helps you from the community level to show what you have been doing, and also for other people watching the documentary or the film to learn exactly and see how they can change. For example, when I watched the documentary from Mexico, there is a lot that I picked from that. And so working from different professions, it had value to what we are doing. And the other thing I just want to say, for us in Sierra Leone, we are privileged because we are small in number, just something around 7 million. So campaign or raising an awareness on something easily creates attention because you use the national television, it's reach everywhere. So at the end of the day, government will listen and so forth. But what we are able to really, the opportunity we are able to really seize is that government is willing to listen and see how they can make a change. Because if they don't create the change, we'll keep talking about it. And sometimes if government didn't want people to begin to pound on them on certain things, because our politics in Sierra Leone is very critical. The opposition might take that one and use it against you because you are not able to handle this situation when it was out. So we are sure we use that opportunity and we are creating a change. But one thing that struck me when we are doing the documentary, someone told me, say, you know that even if I eat a bag of salt, I will not know that I've eaten a bag of salt because I've lost the sense of taste. He said because government should now put a tax increase on alcohol rather than salt. I asked him why. He said because the more alcohol people take, the more it endangers their sense of taste. He said so now eating too much salt for them, it will not sound anything because they don't even taste it. So for me, that one strike me that it's also another thing we really need to increase, because like Sierra Leone, we don't even have an alcohol policy, neither a law talking about it. So for us, it's really also one factor that people are eating too much salt, but they don't even realize it that they are eating too much salt because they are also taking a lot of alcohol. So that one is striking. But really working with a team, and especially the community people, it also give them that sense of importance, that they are important in society and people are ready to reach on to them to know their problem, and people are ready to talk about that problem. And one of the things also I want to share that for us, we've succeeded that many people are now coming out for screening, which was not like that before. So that one for us is an opportunity and it's a strength for us, because the more they come out, the more they detect their problems and the more they are ready to work towards reducing the content of salt they eat.
Thank you so much, Peter. And that's such great reflections. And equally, thank you for the work you do. It's very important and we're really grateful for it. Let's go over to Rebecca, and any last remarks from you?
Sure. I think that in terms of what we've learned or what we tried to put in practice, in terms of coalition building or alliance building or seeking a stronger voice, seeking a more collective voice. We, as a consumer rights organization, we were really looking at the issue from the very beginning, as a consumer rights issue. What's in our food? Do we know what's in our food? Is it making us sick? Is it making us sick without us knowing? Are we being informed by a label that's the most effective? Are we knowing what the sugar content is? as a society, whether or not we're, looking at the actual, specific figures, but are we understanding that, we are transitioning to an ultra processed reality where that's what's most available and that's what's most accessible. And are we knowing what that's doing to us? And then unpacking that and saying, but then who else would be concerned about this? Well, children's rights organizations should be concerned, and water rights organizations should be concerned, or advocates. And people who, like I said before, farmers are worrying about nutrition, the medical health community, the public health community. Like there are larger ways to look at this, and all of the angles that are possible should be explored. And the conversation with those different parts of society can not only make you a better advocate because you're understanding the issue more, but you're also then be able to create a stronger voice. And what we've also learned a lot, I think, and I can't speak for everyone, but that it's sometimes not a single coalition, right? People aren't always going to be in agreement on everything. But then there are development advocates that are concerned about the issue of inequality, whether that's health equity issues, or whether they're concerned about fiscal policy reform, or whether they're addressing issues of food subsidies or general budget distribution and issues of transparency or corruption. That every door you knock on, right, to talk about how the angle and how this multifaceted problem can be addressed from a systemic perspective, not only strengthens your vision and your understanding of it, but then allows you, when you're dealing with a different issue or a different policy perspective, to create, like a larger concentric circle of who you're working with, of who you're learning from, and who's coming to the table and talking about a policy measure when then it becomes more and more relevant to them. And I think that that's one of the things that we most learned. And I think one of the things we also learned is that there are a lot of members in the academic community, in the academic communities that are out there, that are very conflicted with the interest of who finances them, who are very conflicted with the interest of what their university policy is. Many times they're restricted in their voice or how they can support a policy initiative, but they have other ways that they can help. And when sometimes they're restricted by their kind of the bureaucracy or the infrastructure of the university, but that doesn't mean that they can't be contributing their science, and they can't be telling you that their article's coming out and that it can be used for something. Maybe they won't be able to speak publicly, but that many times there aren't enough connections with the different members of the academic community who aren't conflicted by that financing, who aren't conflicted by their economic interests, but that who can also be very strong and important allies in this process, and who are wonderful spokespeople to be able to disseminate the science and to be able to tell us what's metabolic disease, what is that, and how do we unpack it, and why is sugar addictive? There are a lot of journalists who are interested in that as well, and they need to not only be hearing it from advocates who also are talking about the science, but to hear it directly from the scientists and from people who have the evidence on hand. And so I think that those are some of the most important kind of connections and realities that that we were looking for, to be able to have many different people talking about the issue, writing about it in editorials and columns, publishing on it. You need to get that conversation and that debate started. And that means also that then that the decision makers are hearing what they need to do from many different voices and not just from a single channel. And so it's really about building a single collective voice, or as many voices as you can, right? Talking about the policy
And
change
just
that
getting
needs
it
to be
out.
made.
Yes, definitely. No, that's very interesting, and equally is a bit reflective of the questions I had and the comments we had from Ibrahim and others about what the academic community needs to learn potentially to do better in some ways, and to join you in that, putting on that front and putting out their voices in many ways. Karen, any last remarks from you? And thank you so much to Rebecca and to Peter again.
I just have to say that I thought about making a film about diabetes in Mexico when I was down there in 2008 and 2009. But it wasn't until I read in the paper that the soda tax had passed in 2013 that I thought, okay, now that's got a happy ending. So I just want to thank all of the people that were working on those initiatives in Mexico, like Rebecca and Alejandro and everybody else, for giving us a happy ending, because, you know, and continuing to give us wonderful news from Mexico and how much we all value your work. It's really, you know, it warms our hearts that you guys are having success, and we want to amplify your success as much as we can and give people hope that are working on these issues.
Thank you so much. And thank you very much to all of you. And equally, again, thank you to everybody who's joined us this evening. Well, evening for us. I know it's morning for some of you. And there's so much inspirational knowledge, but equally so many inspirational messages to really take away. So I'm just going to encourage everyone, if you've not already seen it, and I know Tizo, I think, had a question about El Susto, and again, I'm encouraging you, please go to the website, please watch it. It's still available for another day. And again, as many of the videos equally that showcase the work of Peter and our colleagues, equally raising awareness on the risks of non-communicable diseases. But thank you so much to all of our lovely panelists tonight. And I hope to speak to you again in future and learn more about more successes.